New Year, everyone, and welcome to another year of CBCLIPS. In this episode, I present you with an ex-premature baby boy who continues to improve from a respiratory standpoint, but still has abnormalities on the chest X-ray. Let's look at the chest X-ray. We see a large thymus with some tracheal deviation to the right. That's not unusual at all in a baby of this age, especially when they're premature, but we also see bilateral focal diaphragmatic elevations. I call them elevations because diaphragmatic anomalies are a spectrum, from focal eventurations to complete eventurations to hernias with a sac to diaphragmatic hernias. And the question is, do we need to image further? And the clinical principle I would like to cover with you is that cross-sectional imaging for congenital eventurations typically does not add much at all beyond the chest X-ray. Here is an example of another patient with a focal left-sided eventration, and you can see all the MRI shows that the spleen is sitting under the eventration, but really does not add anything to the management. Should we do fluoroscopy? Fluoroscopy is very useful for acquired eventurations, but again, does not usually add anything for congenital eventurations or focal eventurations because almost all these diaphragms will in fact move under fluoroscopy. So how should we manage these patients? And this is really the most important clinical principle. The patient should be managed by trajectory of findings and by symptoms. Patient remains asymptomatic. Typically, many of these eventurations will in fact improve. You can see in this patient whom I followed for 12 years that the diaphragm almost completely normalized by the time the child was 12 and was improving steadily along the way. When application is needed, I would recommend a thoracoscopic plication, and you can see an example of a thoracoscopic plication in this video. The last and final clinical principle is to remind you that gastric fixation anomalies can be associated with diaphragmatic eventration, as you can see here in a gastric volvulus associated with an eventration. So when you have a patient with GI symptoms and eventration, have a very low threshold for working that patient up. Thank you, and until the next CBCLIPS.